Today is the World Arthritis Day, 12th of October 2022. And I'm here to talk about certain lifestyle aspects of improving the quality of life, reducing the pain and inflammation when a person is suffering from arthritis. My name is Rajiv Ambat. I'm the CEO and founder of NuvoVivo Center for Obesity, Lifestyle Disorders and Research. We are an online health and wellness company which works with clients from across the globe and help them manage or even reduce their reliance on medications for lifestyle diseases such as diabetes, cardiovascular diseases, arthritis, fatty liver, hypertension, PCOS, thyroid, etc. All right, so coming back to the topic of discussion, which is arthritis. I'm sure you know already what arthritis is. It's basically inflammation of the joints of our body, creating excruciating pain and impacting the quality of life. When we talk about arthritis, there are different types of arthritis. Of course, there is osteoarthritis, also known as OA for osteoarthritis. Then there is RA or rheumatoid arthritis. Gout is actually a type of arthritis, by the way. There are other categories again, such as ankylosing spondylosis, so on and so forth. But let's talk about OA and RA, the most common of the arthritis. Now, OA or osteoarthritis and RA, the rheumatoid arthritis, the primary difference is that rheumatoid arthritis happens because of an autoimmune disease. It's an autoimmune disease. Basically, body's immune system is attacking its own tissues. Here, in this case, the tissues of the joints, causing inflammation and corrosion or degradation of that joints and causing pain and affecting the quality of life. That is RA, rheumatoid arthritis. It is autoimmune. OA, in the other hand, is basically it's not autoimmune. It happens because of excessive physical activity or exertion. So, if a person is doing excessive physical activity and exertion, or the person is overweight, for example, the joints would rub against each other, causing wear and tear, and that is osteoarthritis. Now, in most cases, osteoarthritis happens in one of the joints, like if it's there on the left knee, or it is there on the right knee, that way, or it is there on the left elbow, like that. Whereas rheumatoid arthritis most often happens in both joints. Like if there is on the left knee, in very high chance it will also be there on the right knee, that way. So that is one of the primary difference. Not in all cases, but in most cases, this is how it is going to be. Okay. Now, osteoarthritis obviously happens, as I earlier mentioned, because of excessive weight. Now, how do you manage this? Obviously, reduce weight. That's very important, so that the impact between the joints and the bones would be reduced with less chances of wear and tear and further inflammation, right? Second thing to do is also to improve the quality of the muscles around the joints. Now, sure, you would have heard perhaps the orthopedics would suggest the people to do some exercises to improve the muscles around the knee if there is a osteoarthritic knee. This is because the muscles around the knee, in this case, we're talking about the quadriceps, the hamstrings, the gastrocnemius, and the calf muscles. All these muscles are like a cushioning agent. It's like a shock absorber of a vehicle. Every time the vehicle gets into a small bump or a gutter, the shock absorber will absorb the shock. The same way, the muscles in our body absorbs a lot of shock. So if the quality of the muscles or the quantity of muscle is much lower, and if the person is also overweight, a lot of this stress and tension will go between the joints, causing wear and tear. So reducing weight and improving the quality of muscles there is extremely important if you were to reduce the impact of or wear and tear between the joints. Yeah. So that is osteoarthritis. Women especially are very susceptible towards this kind of osteoarthritis because of brittle bones. Yet another term called osteoporosis, which basically means the bones become weak and brittle. This happens because of low vitamin D. It also happens during the menopause time. Women are more susceptible to weaker bones. So in such cases, the bones become very weak, and then with a small wear and tear, it would very fastly corrode. So, and that also can cause to osteoarthritis. So that is osteoarthritis. Rheumatoid arthritis, as I earlier mentioned, is an autoimmune disease. It happens because the body is attacking its own tissues. Here, you would definitely need help of an immunologist or a rheumatologist to work with you and give you necessary medication. Sometimes it might be some non-steroid anti-inflammatory drugs. Sometimes it would be some sort of corticosteroid-based drugs. Sometimes it might be some sort of immunomodulators. The doctor is the right person to tell you what kind of medicines, how much, how far, and how to kind of go ahead with these medications. It is extremely important to not self-medicate. Do not upregulate or downregulate the dosages of the medications either, right? It's very, very important because it is an autoimmune disease and it requires an expert to be there to kind of identify and what needs to be done in the future course. So that's about the rheumatoid arthritis. Now let's talk about the lifestyle aspect of it. One, of course, I already said, losing weight, improving muscles. Reducing inflammation is extremely important when you're dealing with these kind of diseases. Now, how do you reduce inflammation? There are a couple of ways of doing that. One, of course, include anti-inflammatory agents. What are some of the anti-inflammatory agents? Antioxidants are known to be anti-inflammatory in nature. The curcumin or the turmeric is a brilliant antioxidant. A lot of Indian spices are also rich in antioxidant capabilities, such as cloves, cardamom. These are all very rich in antioxidants. So include that. Include a lot of fruits and vegetables. All those bright color that you would see in fruits and vegetables are nothing but antioxidants. So include that. It reduces the inflammation in the body. It nullifies the free radicals in the body. So that's how it reduces the inflammation. Omega-3 fatty acid, such as fish oil, flaxseed oil, or even the algae oil, you would get the capsule, or you can also include fish or these kind of things in the diet in the right manner. Including these omega-3 fatty acid also will help in reducing the inflammatory markers of the body. So inflammation is lower, which means the pain and that thing would also come down, and the quality of life also would improve. So that's on the dietary part of it. Of course, if a person is overweight, reducing the weight, and in fact, when I say reduce the weight, let me be very let me make it very clear. What I mean is that reducing body fat without losing muscles. That's extremely important for the reasons that I earlier stated, because the muscles are the cushion which absorbs a lot of shock with all the running, jumping, and all the activities that we do. So that's important. Yeah. Now there are, again, as I said, there are many other types of arthritis also. One of the yet another arthritis that immediately comes to my mind is ankylosing spondylosis, a very rare condition, but it happens because the bones of our back kind of fuses together, and that causes ankylosing spondylosis. Then there is gout. Gout happens because of excessive uric acid in the blood, kind of goes and deposits in the small joints. Mostly gout is seen in small joints. Small joints means the joints which, such as your joints of the fingers of your feet, hands, etc. Sometimes it also happens in the knee. And this is basically the uric acid in the blood kind of crystallizing and forming small crystals. And these small crystals would deposit in these small joints. And when these small crystals gets deposited, it falls between these joints whenever we move our hands or feet. And then these small crystals, like grain of sand, will rub against these joints, causing inflammation, thereby causing pain. So that's basically the gout. So how do you manage gout? Important to reduce protein, especially protein which contains purine. They are red meat. Most of the fishes, especially anchovies, the mackerel, tuna to some extent, prawns to some extent. So fish is rich in this kind of purine, which causes high uric acid levels in the blood. Then reducing high sugary, high fructose kind of sweet related food is also important to reduce uric acid levels. Include a lot of water. Drink at least 3 to 4 liters of water minimum. It will help kidney to flush out uric acid through the urine. So that helps. Drink a lot of water. Alcohol is yet another thing which increases the serum uric acid levels, thereby causing gout. So these are all the things which needs to be done. Doctors, I mean, from a therapeutic point of view, would give a febuxostat or an allopurinol. Again, do not self-medicate. Please do ask take a consultation of a doctor before you kind of go ahead and do these things. Yeah, that's important. From a lifestyle perspective, reducing these kind of purine-rich protein, including a lot of water, reducing especially sweets and high fructose food, and reducing alcohol will definitely help in managing gout. There are many other arthritic conditions, varieties of conditions. Some of it can be much debilitating also. Something which is also related to arthritis would be SLE or lupus, which happens which is a very severe autoimmune and inflammatory disease, which impacts multiple parts of the body, not just joints but also other parts of the body. So there are many other types and varieties of arthritis. So yeah, so how do you know if a person has arthritis, right? So if it is an osteoarthritis, I mean, as I said, it's wear and tear. But if it is rheumatoid arthritis, or if it is any sort of autoimmune related arthritis, there are certain tests which can be done. Of course, your CRP and ESR levels, the C-reactive protein and the erythrocyte sedimentation ratio, which these are all inflammatory markers which you would get when you take a complete blood count, CBC. That would kind of give you an indication as to if there inflammation in the body. Then there are autoimmune markers such as RF factor, the rheumatoid factor, anti-CCP, and ANA. These are all the things that you can check to understand if there are these autoimmune markers pointing to an autoimmune related arthritis, which is rheumatoid arthritis. With regards to, yeah, I want to talk about the supplements. With regards to supplements, which can sometimes help. I mean, there is no conclusive evidence that it would help, but then in our experience of having worked with our clients who have these kind of arthritic issues, we have seen that if you include some supplements which has glucosamine, chondroitin, or collagen, to some people, for some people it helps. So there is no conclusive evidence that it helps for everyone. Collagen is basically the structural part of bone and tissues. So including collagen, even skin is collagen. So including collagen will definitely help. There are no known side effects of having them as long as it is well within the safe limits. So these supplements are okay to have, but I wouldn't definitely guarantee that this is going to solve your issue. But in my experience, it probably works for 50% of the people. So include that. From a dietary perspective, as I said, stay on a calorie deficit, reduce weight, and when you're losing weight, please make sure that you're not losing muscles. And that's why it is important for it to be a structured nutrition. Reducing food and losing weight is very simple. That's not going to help in managing arthritis, but you need to do it such that you lose only fat without losing muscle. So that's on the include a lot of antioxidants, omega-3, which I already explained. So that's on the dietary part. On the exercise part, now exercise is quite little tricky when you talk about arthritis, because of course your movement is kind of curtailed. So you cannot be doing a lot of high impact activities or exercises when you have an arthritic knee, right? Of course, the last thing that we would want you to do is to run a marathon or try to do a skip or a jumping jacks when you have a arthritic knee. But at the same time, exercises are important because exercises are also anti-inflammatory. But the thing to understand is that exercises done in a structured, scientific manner is anti-inflammatory. But if you overdo exercises, then exercise can actually become inflammatory and do more harm than good. And exercises also needs to be structured depending upon where do you have the pain, which part of the joint is impacted. Depending upon that, you need to do exercises, right? I mean, common sensically, if a person is having an arthritic knee, either an OA or an RA, don't go ahead and do a squat or don't do a lunge, right? So that way, so do exercises, but a combination of stretches are extremely helpful. Yoga stretches are extremely helpful, but then again, be careful as to what kind of yoga stretches do you do. For person having, as I earlier explained, an ankylosing spondylosis, if he tries to do a Padahastasana, which is touching the feet without bending the knee and your forehead touching the knee, that can be extremely dangerous for a person having ankylosing spondylosis. It can actually make things worse. So when I say yoga, flexibility related exercises are helpful, but again, needs to be done and applied with common sense. So that's about the exercise aspect. Autoimmune diseases are also has this thing that when you are stressed, when you are psychologically or mentally stressed, there will be a flare up. So make sure that you do meditate, you do some breathing exercises, try to calm your nerves. These things are also comes a long way in managing these kind of autoimmune related arthritic issues, especially like rheumatoid arthritis, lupus, etc. And generally kind of drink 3 to 4 liters of water. All those things is something that I don't have to necessarily tell you. I'm sure you know it already. Sleep, at least 8 hours of sleep. That is also helpful because sleep is one of the important factor which regulates the overall health. So that is also important. So I hope these small inputs are helpful. I hope you continue to stay healthy. And if you have any issues of arthritis or related aspect, I hope that you're meeting your doctor, your ortho or rheumatologist, and taking necessary therapeutic side prevention intervention. At the same time, lifestyle interventions and inputs that we have given you has come across helpful, and I hope you implement it. Stay healthy, stay fit, and stay young. Take care.